So today we'll be doing clerking on hypertension. So we've done some previous clerking before. Actually, we've not done clerking much. So we'll be starting clerking in full. So clerking on hypertension is quite a bit different. If this is your first clerking video you are watching, I will encourage us all to go through the previous introduction to clerking so you can understand the pattern on clerking. So you understand what to start with when you are clerking. So for clerking, first, don't forget any form of clerking. Just a quick review. You want to grade the examiner. You want to grade the patients. You read your question. The examiner will ask you to read your question for Mdcn exam. And also after reading your questions, the examiner can get your ID card from you and just take a look at your number. Then you go to your patients. Then you start your clerking. So when starting your clerking, you have to grade the patients. So I've explained how to grade the patient. You have to obtain consent from the patient. You have to introduce yourself. You have to create rapport. Okay. So after this, you want to ask about the bio data. I won't be going over all these things again because I've done this in introduction to clerking, introduction to clerking. So I will encourage us all to go through the previous introduction to clerking video. So after you're done, if it's a female, you want to ask about the reproductive profile, the last day of the menstrual flow, you want to ask about the EDD, estimated date of delivery, the EGA, expected gestational age, if she's aware of it, yeah, for the exam. And after this, if it's not female, you don't need to ask that. After this, you want to clerk your presenting complaint. Okay? Please don't forget, for hypertension, the patient might not come with a specific presenting complaint. So the presenting complaint, the patient might just tell you like, this patient is presented and on a routine examination, it was noticed that this patient have elevated blood pressure of, let's say, 150 over 100 millimeter of mercury. And you've been asked to take a focus history from this patient. This is a very different scenario. Here, there's no specific symptoms you will be given. So you know this is hypertension. So there's nothing to actually clerk as a presenting complaint where you use your doctor. Okay? So you might not have to do this, but you have to ask some specific questions from this patient before you start. And what are these questions you'll be asking from this patient? This might include things like other symptoms of hypertension, other symptoms the patient might be experiencing. So after you greet, let me just write, greet your patient, you introduce yourself, you create rapport, then you obtain consent. You know how to do this. Good afternoon, ma. Good afternoon, sir. I'm by name so and so. How are you doing today? Please, I would like to ask you some few questions regarding your health. Can I proceed? That's it. Simple as that. So once you are done, you ask for your bio data. I don't have to go through all this because I've done it before in previous videos. Please go over the introduction video. So after the bio data, the next thing you want to do is, are you there, doctor? Can you hear me? Hello?
Yes, I can hear you, doctor.
All right. So the next thing you want to do at this point is your presenting complaint. Other symptoms. So other symptoms. You know, normally you are supposed to clerk using doctor, but you're not clerking using doctor here because you don't have a presenting complaint. So you ask some other symptoms. What are those other symptoms you want to ask? You want to ask if the patient has been experiencing things like headache. You want to ask maybe the patient has been experiencing all those symptoms that are associated with somebody who is hypertensive. Maybe dizziness. Maybe things like, give me an example, tinnitus, like ringing in the ear. Like, have you been having any ringing in your ear? Things like
maybe blurry vision.
Blurry vision. Blurry visions. You understand? Irritability and so on and so forth. Epistaxis, bleeding from the nose. Nose bleeding. You understand? etc. So you want to quickly ask all those common symptoms that are associated with this whole hypertension. So after you're done with this, before you start your presenting complaint, it's important to also ask some main questions. And what are those main questions you want to ask from these patients? Let's say main questions. This is peculiar to hypertension. Those main questions that you want to ask is where, when, how did you check your blood pressure? How many times did you check your blood pressure? You understand? These questions are very important questions. So you want to ask questions like, let's say, where was your, let's say, BP taken, your blood pressure taken? When was it taken? You want to ask how many times was it taken? Are you getting me? Please take note. These are very, very important questions. You want to ask, was that the first time? Was that the first time taken? Please, these are very important questions you need to ask from these patients. Okay? So once you're done with all these, you want to ask for causes. So there are a lot of causes for hypertension. So you now do history of cause. These are the first set of questions. The next thing will now be history of cause. So this is the main part. Don't forget, the only part missing here is your presenting complaint. It's your presenting complaint where you clerk using doctor. There's nothing like that here because it was just, most cases, hypertension is gotten on routine examination. Take note. So history of the causes. So you want to analyze the history of cause. The history of cause. So what are the causes of hypertension? Obviously, there are a lot of causes of hypertension. This is where you want to ask the patient, what are those things that might cause hypertension? Do you understand?
All right.
So we want to talk about the causes, the major causes. There are a lot of causes that can result into a lot of reasons why people can be hypertensive. So you want to rule out the major causes first. This is very important. There are different causes. You can classify the cause into cardiac cause, extracardiac cause, but it's better you go with the main causes here. So you want to ask what matters more. You don't really have much time in this exam. Don't forget, you have 5 minutes each station, less than 5 minutes approximately, because for you to move from one station to the other, your time is going. So let's talk about the causes of hypertension. So the number one major cause you want to talk about is what, doctor? Family history. Am I correct?
History.
Family
Yes,
history is very, very important. So family history is one major cause of hypertension. And please, I always repeat, how you ask your question actually matters a lot, especially in this scenario. How you ask matters a lot. You don't just say family history of hypertension. No, you have to construct your question the way the patient will understand. So you want to ask, do you have any family history of hypertension? Are you getting me? So
yes,
family history, history of hypertension, question mark. Mind you, that day of the exam, some simulator will not respond, some will respond to you. So it doesn't really matter. If they respond, good. If they don't respond, good. You just continue asking your question. You understand? Apart from family history of hypertension, what other causes of hypertension that we have? Any previous history of hypertension? Very common in our environment also. People who drink, who smoke, sorry. Yes.
yeah,
Smokers and people who drink. So you want to ask, do you smoke? Do you smoke or do you smoke? You can put that one question mark. Cigarette smoking or anything. Do you drink? Some people, when you ask, do you drink? They will say, yes, I drink. You want to be specific. Do you drink things like alcohol? Alcohol heavily. Let's say heavily. Question mark. Do you understand? These are very common causes. Again, in our environment, salt intake is a very common cause of hypertension. Like it could be related to it also. You want to ask, do you like adding extra salt to your food? Maybe after cooking, you want to eat. Some people will demand that, oh, the salt is not enough. So you want to rule out this. Do you like adding, you like adding extra salt to your food or diet? Do you understand? Then the next thing you also want to rule out is what? And doctor, what other in our environment? What other thing could predispose in Nigeria to be specific? What other thing?
Diabetes, maybe.
Diabetes, yes. Apart from even diabetes, very common is obesity.
Obesity.
Overweight. Yes, a lot of people are overweight in this country. So you want to also rule that out. A lot of people are actually obese. So how do you want to rule that out? You don't want to ask, are you obese? No. Some patients don't even know what is obesity. So you want to ask them things like, when last did they check their weight? If they actually do. Or do you want to ask them, do you want to be polite with them? Do you notice you've been gaining weight, or anybody told you that you've been adding recently? In a very polite way. Do you understand, doctor? Okay, you want to ask,
Yes, doctor.
when last did you check your weight? Do you understand? Or you want to ask, did anybody tell you that you've been adding weight recently? Do you understand? So other things that could cause, as you said, is what? Things like DM, diabetes. So you want to ask, do you have, let's say, any history of diabetes, or let's say any family history of DM, any family history of DM, diabetics? Please take note. You want to ask this question. It's a very important question. Then apart from this, there are other causes also, doctors. What other causes you want to rule out? There are a lot of causes.
Maybe previous history of any kidney disease.
Yes, any kidney disease. So any renal disease. So you want to ask, have you been diagnosed of any renal disease before? Have you been diagnosed of any renal, or let's say kidney disease before now? Or you want to ask about any flank pain? You understand? You want to rule it out.
Yeah.
You want to rule out very common thing also. Things like people who live a sedentary lifestyle, people who don't exercise themselves. You want to ask about things like that also. Like, does the patient live a sedentary lifestyle? What kind of occupation is the patient doing? You understand? So you want to ask if the occupation permit the patient to do exercise. Or you want to ask, do you do exercise regularly? Or do you exercise regularly? So people who live a sedentary lifestyle, you want to rule that out. Even you want to rule out things like, what is it called? Cushing. Very important, Cushing syndrome. So you might want to rule out Cushing syndrome. The patient doesn't understand what is Cushing syndrome. So you have to link up your question. How do you link it up? You want to ask the patient, you know, the classical symptoms, how a patient with Cushing looks like. Do you understand, doctors? They have a bloated face, they are overweight, you know, they have this kind of central obesity sort of a thing. So you want to ask about any weight gain with accompanying bloated face. If it's a woman, you want to ask about menstrual irregularity. Are you getting? So you want to ask things like any history of, let's say, weight gain with bloated face. See this moon-like face. You understand? If it's a female, you want to rule out anything like hypertension in pregnancy. You want to rule out things like menstrual irregularity and so on and so forth. And very important, doctors, to rule out here is also pheochromocytoma. Pheochromocytoma is associated with the 5 Ps. You remember the 5 Ps, doctors?
Yes.
Palpitation, What other things? Tell me the 5 P's of pheochromocytoma if you remember. Palpitation,
Palpitations,
perspiration,
then
perspiration,
perspiration, then
paroxysma. And there are about 5 P's. We can check it up later. I can't remember everything in full, but there are 5 P's. So you want to rule out pheochromocytoma. So you want to connect these things together. Please take note. This is very, very important. So you want to ask the patient about any attack of maybe chest pain, sweating, and you feel your heart beating out of your chest. Any feeling of feeling your heart beating out of your chest. Do you understand? So you want to rule out things like pheochromocytoma. So this is tumor of the adrenal gland, just on the adrenal gland there. Right? If I'm correct, right? Hello, doctor,
yes,
can you hear me?
Yes. You said, sorry, I didn't hear the last thing you said about
I said pheochromocytoma. Like tumor of where?
Adrenal.
Yeah,
The
tumor of
medulla of the
adrenal.
adrenal.
Yeah. So we're talking about the next thing that is very important. We want to rule it out. We want to ask about any previous history of, let's say, sudden attack of, let's say, headache with sweating. Patient sweat a lot, sweating and patient might not understand palpitation. You might want to ask things like feeling of your heart beating out of your chest. You understand? How many have you mentioned, doctors? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10. That's enough. Okay.
Yeah.
The other causes you might want to rule out, but that is enough. There are a lot. You said something.
Doctor.
Yeah.
Yeah, I wanted to confirm. What about drugs like NSAIDs and
yes,
OCPs?
OCPs, all those things can also be. Yes, you might also want to rule it out. It's actually very common. It should even come before pheochromocytoma. Thank you, doctor. So you want to ask things like any history of drug, or do you use drug? Do you use drugs like steroids? Do you understand? Steroids. Things like NSAID and non-steroidal anti-inflammatory drug. Things like OCPs. This is for a lady. You understand? So you want to rule all these things out also. It's very common also in the environment. But please, mind you, this exam, you don't really have much time. At least say the few you can remember and move. Other point also carries mark. Do you understand? So based on our introduction video, immediately after your history of course, the next thing we need to do is what? Is our complications. Yes. So you want to do the complications. What are those common complications? I like to look at it like this. Just imagine from the head downward. So you want to ask about your complications. So it will be easier for you to remember complications. So the complication, it can affect the brain, the CNS, the central nervous systems. So if it affects the central nervous system, how do you want to rule it out? How do you want to ask questions regarding that? So you want to ask about things of like loss of consciousness. Maybe you want to ask the patient, have you ever felt this loss of consciousness or convulsion before? Loss of consciousness, or let's say convulsion or convulsion. Some patients might not understand convulsion or seizure, that they have to rush you to the hospital and you don't even know where you are. You want to try as much as possible to streamline your question so the patient can understand. And also, apart from this, you might also want to rule out things like stroke. So maybe there's loss of sensation in any particular part of your body. So how do you ask this question? You want to ask the patient, have you, because of this condition, been rushed to the hospital before, that you don't know, that you're unconscious, and as a result of that, you can't really feel any part of your body because of this again. Am I making sense, doctor?
Yes, doc.
So this is to rule out CNS affection if the CNS is involved. Do you understand? So after the CNS, other complication, it can affect the eyes. This one is CNS. If it's affecting the CNS, let me just write it here. Let's say CNS affection. It can also affect the eyes. And if it's affecting the eyes, what can it cause? Retinopathy. You remember all this? It can result into retinopathy. So how do you want to ask? You want to ask any history of blurry vision because of this condition? Any history of blurry vision? You want to ask the patient. Apart from that, let's go down from the eyes, we go to the chest. It can affect the heart also. Don't forget. CVS. You are saying something, doctor?
No.
Okay. If it affects the, what's it called, the CVS, how do you want to ask question from this? You want to ask for palpitations, for any history of chest pain, for any difficulties in breathing, dyspnea, and all the rest. So you want to ask, you want to join these three things or two things together. So any history of chest pain, comma, you understand, with, let's say, with feeling of your heart beating out of your chest. This is palpitation. This is how you ask. You want to ask a question. Do you understand, doctors? You can also use dyspnea. Or do you use a lot of pillow to breathe or something? You might want to rule that out also. This is CVS. So apart from CVS, other thing that could be affected is where? Your renal system.
Renal.
Yeah, renal system. If it, depending on the causes of the hypertension, we don't want to go into the causes and everything of hypertension. So you want to rule out renal system. So you want to ask about what? Any problem with urination? Any problem with urination? Maybe polyuria, polydipsia, and polyuria, nocturia, anorexia. Maybe the patient have any flank pain, back pain because of this. You want to rule it out. Any problem in urination? Or do you notice you urinate a lot at night? Do you urinate a lot these days or at night? Let's say at night, to rule out what? Noturia. You might also want to rule out things like polyuria also. How many times do you urinate in a day? How many times do you wake up at night to urinate? Are you getting me? Any weakness, any flank pain. Still under the same thing, you might also want to rule out erectile dysfunction. Some men actually have erectile dysfunction in this level. It can result, it can be complicated. So you want to rule out things like erectile dysfunction. So how do you ask your erectile dysfunction? You want to ask if it's a man, do you have difficulty maintaining an erection? It's actually very easy. Any difficulty with sexual performance or maintaining erection or with sexual performance. You understand? You want to rule that out. This is very important. So there are other causes. You might even want to rule out hematological causes, like all this bleeding from the nose and the rest. It's also something you might want to rule out. You might want to rule out respiratory causes and complications. All these are complications. So let's say under hematological causes. So what do you want to rule out on hematological cause? So you want to ask about what? Things like what, doctor? Any bleeding from the nose?
Yeah, bleeding from the nose.
Any bleeding from the nose. Okay? So, and pulmonary also. You want to ask about respiratory complication. Respiratory complications. So you want to ask about difficulties in breathing. Are you getting me? Any difficulty in breathing. Please take note of all this. There are a lot of complications. You might even want to rule out GIT. Most of them have ulcers. You understand? But we don't really have enough time. This is okay to rule out. It's an exam. And this exam is more of like a showmanship. Are you getting me? So you ask the few things,
Yes.
then you move to the next. So immediately after you're done with this, on our clerking, after complication, the next thing is caregiving. Do you remember, doctors? It's caregiving. After
Yes.
complication is caregiving. If you remember what we discussed about, after complication is caregiving. So what do you want to ask under caregiving? What the patient has done. So you want to ask, what have you done so far? Do you understand? Please, on our previous videos, I've explained all this caregiving part. I've explained everything. Please take note. You can go over it again. I've explained. So caregiving. So all these one are constant. They're always going to be there. So you want to ask, what have you done so far? Any investigation? Investigation done. Okay. Any investigation done? Have you visited any hold on. So still on the caregiving, you actually want to ask about any investigation done, any ABA concussion taken before now. You want to ask, you want to rule it out. Any AGBO, the ABA concussion taken. You want to ask. Any, if the patient has been to any pharmacy before coming to the hospital, any investigation done, anything at all the patient has done, this is where you want to rule it out. Any ABA or any, what's it called? Maybe some patient will have visited prayer houses, anywhere, anything the patient has done, you want to rule it out. The patient should tell you. This is where you want to ask about caregiving. Okay? So immediately after caregiving, the next thing you want to ask about, the next thing you also want to ask about is, okay, any about concussion? Any about concussion? Hello, doctor, please can you reply in the chat box here if you can hear me? Hello? So you want to ask about any about concussion taking, any about concussion, sorry. Any about concussion. I think concussion will be with the any about concussion taking. I think with the CEO concussion. Okay, concussion. So immediately after all this, I think the next part, if it's a female, you want to go to the, what's it called? Gynecological, clerking, and obstetric history. But let's assume this is a male. So if you're assuming this is a male, you just go straight to your previous, medical history, family medical history, all those normal things that were an introduction. Then you follow the same thing. Please, you follow the same set of things we normally do before. So you want to ask the patient about the, you want to ask the patient about things like previous medical history, previous medical history. You want to ask about the medical and the family history, not just under the previous medical history. You know how to ask. You use the acronyms, SHADE. Please refer to our previous video if you really want to get this part very well. You ask about the drug history, the allergy history. You ask about the family history. You ask about the social history, then systemic review. I don't think I need to write this because of the length of the video. So please, doctors, go over the previous video if you really want to go get to know the other parts. Okay? So that is it about the other parts. Any question, doctor? Any question? Please reply with the chat box. Please let me know if there's anything, any question at this point. All right, in the absence of no question, that will be it for hypertension in pregnancy. So some other people, if you have questions, please don't hesitate to drop your questions.